Hello, everyone. We're here at another episode of Salud Sisterhood, and this time we have board-certified endocrinologist working in the Upper East Side in New York alongside Dr. Rocio Salas Whalen, and welcome Marcelle Pignanelli. Thank you for being here today.
Of course, my pleasure. Thank you so much for having me.
So we have some really interesting topics that the community has been asking about. And so I'm really excited to speak with you all different topics around hormone health as it pertains to midlife and postmenopause. So let's get this rolling. So just to kick things off, why do you think so many women are losing their libido after 40? Is it just part of aging, or is that actually, something that does happen or something in their mind? Like, how does that work?
Yeah. So, women in their 40s usually enter menopause, perimenopause, more commonly. And being in that age range, you have a lot of fluctuations in hormone levels. You have hormones such as estrogen, progesterone, testosterone that are kind of up and down, up and down. They usually are up and down because of the menstrual cycle, but now, the fluctuations are a bit more extreme because the ovarian reserve of estrogen they're running out, right? So when you have those changes and fluctuations, then you do have lower testosterone, right? As well, because testosterone production is linked with estrogen production as well. So by that production of hormones lowering, your libido can lower. Libido is mainly driven by estrogen and progesterone. And testosterone. All these hormones play a role, so that can explain. Now, that doesn't mean we're doomed. We can still have a sex drive in our 40s, 50s, 60s, 70s, 80s. It can still happen. If you need help with agents, there's multiple agents that can help that, but including testosterone gel. But yes, so it is common to see that.
It's common and there's like a solution for it. Like
There
there's
is a
ways to treat
solution.
it. Okay, great.
Yeah.
And why do some women experience vaginal dryness or pain even if they're still having periods?
So because of the same reasons of that I stated prior, when you have these fluctuations, the whole body takes a hit, right? You can start, even while getting a period, you can start experiencing hot flashes, night sweats, high heart rate, something called palpitations. You can have vaginal dryness as well because you have the estrogen going up and down depending on where in the cycle. And that there's a lot of estrogen receptors in the vaginal tissue. So by not having enough estrogen binding to those receptors and keeping that tissue nice and moist, therefore you can experience dryness for that reason. With vaginal dryness, it could be uncomfortable to have sex. You can have more infections, like urinary tract infections is another thing that can be common as well for those reasons.
And are there any safe, effective treatments that don't involve like just like the lube we can get over the counter? Is there anything that doctors like yourself prescribe?
Yeah, we prescribe Uvafem or Vagifem, which is usually vaginal estrogen. The beauty about vaginal estrogen is that it's not systemically absorbed.
And
So
what does that
therefore,
mean? What does it mean to be systemically absorbed?
good questions. Systemically absorbed means that the estrogen, when you apply it, it's absorbed into your bloodstream and doesn't stay within the vagina. So it means that when the estrogen is in your bloodstream, it's stimulating a bunch of other estrogen receptors that are located in your body and not just the vagina. So for example, the breast tissue. Another example is the uterus. So the endometrial lining of the uterus, that's another example. So it stimulates all these other tissues when we don't really need that. What we need is for the vagina to be moist and ready for sexual intercourse or just being able to urinate without burning and things like that.
So in essence, like a moist vagina is like a sign of a healthy vagina.
Yes. Of course, if there's, smells like fishy smell, that could be an infection, but that's a whole other story and territory. But yes, essentially a moist vagina, lubricated moist vagina is a sign of a healthy vagina.
Okay. And then, in the Latino community, there's a lot of taboos around like sex, sexual health, like even speaking about your private parts. So like, why do cultural silence and shame make sexual health even harder for Latina women to address? I think that maybe it comes from like when we're little and we don't talk about it, but in your experience in treating patients, like, do you see this, happen more often with Latinas or like any specific ethnicity? How can women address this and feel less stigmatized for it?
Yeah. Yeah, it's an important point. I'd say that I wouldn't say symptoms are more necessarily predominant more than others. I do think there's studies on that. I have to actually fact check myself. So before I say, something that's not wrong, but to my knowledge, there's not necessarily worse symptoms for one group rather than the other. It's more so the access to care is not the same. So, hormone replacement therapy, which can be care offered to these patients that are experiencing these menopausal symptoms, are not always offered to Hispanic, Black, Brown patients, unfortunately. And within the Latino, especially within Latino communities and Latina women, I think we live in a we live in a very machista society. You know, Latino men are machista. I mean, it's the truth. Not all of them, but so growing up in a household around the machismo, it's kind of hard to necessarily voice
Mm-hmm.
concerns because it might be just brushed off or it might not be taken seriously or you just don't want to deal with the repercussions of having to explain yourself because you're ashamed of it. There's a lot of shame and guilt behind these symptoms for women. So because they don't want to seem, especially Latina women, we don't want to seem like a burden to people because we do it all, right?
Mm-hmm.
It's very cultural. So, I think that's why it's difficult for them to really voice. But in terms of this actual symptoms, I think it's more of the symptomatic management that's an issue
Mm-hmm.
that not everyone has that access.
And I think also like here in the US, perhaps like the language barrier is also could be like
Huge,
difficult, like
huge,
finding doctors like yourself that speak Spanish that are able to understand. And, it's already a hard topic to talk about. Yeah.
100%, 100%. Another thing is that a lot of Hispanic patients go, just like you said, they go to providers that speak the same language as them. And Hispanic providers, they do what they can, right? Because they do what they can because a lot of times there's insurance issues.
Mm-hmm.
Things, so something like testosterone, testosterone's not cheap. It's testosterone gel that, it's not necessarily super cheap. It's hundreds of dollars, and that's not something that everyone can afford, and that's understandable. So you kind of have to, kind of like feel your way around and see what other avenues you can navigate that might not necessarily be as effective.
Yeah. Yeah. And now that we're on the topic of like hormone therapy, can you explain in very simple terms what is hormone therapy and how women can get it in midlife and post like menopause?
Yeah. So hormone replacement therapy is essentially replacing the type of hormones that we normally produce, but in different quantities. And the main purpose of hormone replacement therapy to date is to improve vasomotor symptoms. What are vasomotor symptoms? The hot flashes, the palpitations, the night sweats, the vaginal dryness, the low sex drive, the mood swings. So all of these things, especially the night sweats and hot flashes and heart racing, those are probably the three strongest that it helps. It helps that mostly. And by helping those symptoms, I'd say almost 100% of patients sleep better because a lot of these symptoms disrupt their sleep. And because they're disrupting their sleep, they have brain fog, they have depression, they have, anxiety. They have by improving their sleep, we're improving not just by improving their hot flashes and their night sweats, we're not only just improving those symptoms, but we're also improving their sleep and all these other symptoms that come along with lack of sleep.
Yeah, it's
So
like a snowball effect.
so and the question is, what is the right dose, right? Because that's the subject that's been, circling around for years and years. And there was a huge research study that basically called the the Women's Health Initiative. And that was done in the late 1990s, early 2000s. And it basically was a group of older women who were in menopause. Most of the women were in their 60s, 50s, 60s, to my knowledge. And they put them on estrogen and progesterone. And there was an arm of the study that showed that these women have had increased rates of breast cancer. But the difference is that, so that's what scares people, not just patients, but providers from prescribing the HRT
Hmm.
today to this day. Why was first of all, the study was not done what we do today. I mean, the study was too much estrogen at the wrong time. That's basically to sum up the study. So we noticed that when we give estrogen in transdermal formulations, meaning in patch form, where you're not taking an oral pill, you have less side effects, such as the increased risk of cancer, the increased risk of clots, the increase. So all these other risks that were noted in the original study, we noticed that we don't see as much of that with these formulations, such as the patches. Um, that being said, there's still contraindications.
Yeah.
Right? There's still contraindications, and that's why it's so important to get these hormones from someone who's trained in this, from someone who is, a doctor who's undergone training, who has the knowledge and the tools to be able to assess you. Also important not to go to these medical spas and get a hormone pellet, because that's like the worst thing you can do, for reasons that we don't know the effects of pellets in the long run. They spit out too much hormone in too little time, and we don't know what that does to the body in the long term.
Yeah. I mean, it almost seems like I know, like my mom, she had never, like, she's been postmenopause. My aunts, like, I did like a mini, like, family survey. Nobody was on hormone therapy. Like, they never tried it. And it's almost like now learning all these things about like proper hormone replacement therapy. It almost seems criminal that they were not given the opportunity to treat their symptoms and just deal with it.
Yeah.
And like, I think that as a society, perhaps, we failed women in that way, like, that we weren't able to treat them for generations. Like my grandmother, my mom, like, it's not just, one generation, it goes many generations. And finally, we're getting some light and some education around the subject.
100%. Yeah, no, it's a good time to be in menopause. It is a good time, because you have options and you have this, and I think as a society, like you just said, I think we're putting more emphasis and more resources and time and money into these things, because this is women's health.
Yep. And we are the majority. Women are 50+% of the population. And it's so
Correct.
crazy to see
We
that
rule the world.
it
So
has took, yep, it's taken this long to get things rolling.
yeah.
And then why are women told to wait it out when symptoms are clearly affecting their quality of life? Like, there's some women that say like, "Oh, I went to my doctor and they did lab work and everything looks normal, but I still don't feel like myself. Like I still feel off, I'm not sleeping well." Like, why do you think that's happening across the board?
So, I think it's happening, like, I mean, it does still happen. I can't, I'm obviously in a biased environment, because here in this environment, thankfully, we have the time and resources to dedicate to our patients. And that's one of the reasons why I really like working here, because I get to really take my time and not rush patients. But I think, to answer your question, I think it's a systemic problem. I
Mm,
think it's a systemic problem. I think, as doctors, we are meant, in quotes. I apologize for the construction, but we're meant to just see patients, and kind of just like target things like quick, 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 and then move on, and not really dedicate the time and energy that the patient actually needs. Because of, we can sit here for hours and talk about it, but a huge issue is insurance, right? Insurance is an issue. So another thing is that providers don't know, like, they don't know how to handle it, because we weren't taught how to handle it.
mm,
We weren't really taught how to handle symptoms such as menopause. We were taught that it happens. We were taught that, it's a clinical diagnosis, and it is a clinical diagnosis. You can get labs if you need it. And then once you know they're menopause, you kind of just like brush it off, kind of, right? We weren't really taught to like treat it and like really pay attention to it. It's sad, but true. I think that now more and more, social media is a huge platform for that. And it's really opening the eyes of many people, not just of patients, but of doctors as well. And I think doctors are coming around and really empathizing. Not that, doctors are not bad people. Obviously, most of them are not bad people. I do think that they're really, we are educating ourselves, not just for our patients, but for ourselves, for our family
mhm.
members also. So I think it's just the awareness is there more.
Yeah, for sure. I see it more and more on social media. I mean, yourself, like you go on your platform and educate people. I love that. And Dr. Rocio Salas Whalen, Dr. Von der Wright, like there's just so many of you out there like doing the good work of educating people so they're able to advocate for themselves for when they go to doctors. Like, I mean, that has been a huge like part of like my health journey this past like 2 years. And it's really been thanks to the information that you guys are putting out there that helps us like understand a little bit more of what's happening in our bodies.
Yeah. Yep. 100%.
And then, I know you touched it briefly, but if maybe you can talk about it a little bit more, like what's the difference between estrogen, progesterone, and testosterone, like when it comes to women? Because I
Yeah.
know men have this too. We talk about them as if they're like sex hormones, but if men have it too, it's just really a hormone that humans have. So, like, what is the difference between them?
Yeah. So estrogen and progesterone are mostly involved in the menstrual cycle. And hormones such as LH and FSH are also involved in the menstrual cycle. They're messengers that tell the ovaries when to, make sure that the egg is mature in order for it to be released for implantation for pregnancy every month. If you're taking birth control, it obviously suppresses that. So estrogen and progesterone mostly play roles with that. When you undergo menopause, your ovaries start saying, hey, it's my time to shut off. I don't have much eggs left to release every month for your menstrual cycle. And so it's time to shut down and close shop. So then the estrogen and progesterone start declining. Testosterone, the ovaries also make testosterone in women specifically, right? Testosterone is also produced by the ovaries, much smaller amounts than it is in men. Testosterone is helpful in our bodies with muscle mass. It's helpful with sex drive. Also, anecdotally, it also can help with mental clarity. A lot of patients who are like on testosterone replacement, they say like they feel like their energy slash mental clarity is back. Testosterone in women, though, when it's produced in high amounts in women who are premenopausal, it's highly linked to PCOS or polycystic ovary syndrome. So what happens is that we need a little bit of testosterone, but when we have too much of testosterone, then that is linked to insulin resistance, and the testosterone does not let estrogen and progesterone do its thing, and it suppresses ovulation. So that's why women with PCOS can have issues, not all of them, but they can have issues with fertility, can have issues with insulin resistance. And so that's basically it.
Yeah, I have PCOS, and when I was diagnosed within my early 20s, like the main thing the doctor mentions, like, okay, we're gonna get your periods regular, get you on birth control, and you may have trouble conceiving later in life when you're ready to have kids. But that was like as much as information as I got, and then now I learned that it's just like there's so much more like metabolically, insulin resistance. I had insulin resistance, so it's just it's so eye-opening to just like start learning more and being able to now ask the right questions.
Yeah, we don't really know why PCOS happens. We don't know. We haven't answered that question. We haven't answered that question. We're not really sure. We don't know if the chicken or the egg came first. We don't know if the increased testosterone is what makes us insulin resistant and, having more issues with fertility, or if the insulin resistance or increased obesity also has to do with increased testosterone. It seems like there's a bi-directional relationship,
Uh-huh.
meaning that like both of them feed off each other.
Yeah.
That's what it seems like when you kind of like look into the literature. But no, it's not a one size fits all. Everyone's treated differently. Those with PCOS, it depends on what exactly is happening, and you kind of treat what it's happening at the moment. There's not like one treatment, one therapy that can help, unfortunately.
Yeah. And I think that also like the name is so misleading. Um,
Yes. The name is very misleading because you don't need polycystic ovaries to have polycystic ovary syndrome. So
right.
yes, very misleading. I feel like that's gonna change. I think that's gonna change.
That I mean, renaming that would be a game changer, quite honestly, because people just think like, oh, I don't have cysts in my ovaries, I don't have PCOS, but like that's
That's
the
not true. Yeah.
yeah. So
Yeah.
so
Yeah.
interesting. And
Yeah.
then is there like a window that's too late to start ovaries? Like if you're like a postmenopausal woman that can't hasn't been sleeping well, like if you're like in your mid 60s, is it too late to start any type of hormone therapy?
So as per The data, I mean, you wanna start it within 10 years of menopause as per the data. Now, that doesn't mean I haven't started someone on a very low. If you're, like, in your early 60s and you've been in menopause for, like, 11, 12 years and you're like, "Doc, I still get hot flashes. This is crazy," and you don't have any contraindications, I will try a low dose patch of estrogen with some progesterone. I will try a low dose and hope that that will help. You can try it. It depends on the provider, right? But and you can find providers that are willing to do it, not just me, obviously. But technically, because what happens is that there's like a window where estrogen is protective on the heart, but too much of it, and when you get it too late, can increase your risk of heart disease. So that's what was postulated back with the WHI, the Women's Health Initiative, is that it can increase your risk of heart disease because it might be too much estrogen for the heart. But with time, we noticed that estrogen can be protective for the heart, but at the right doses. And I'm going to use this like, leniently and at the right time.
Right. Okay. And just to close off the hormone therapy conversation. So,
Yeah.
if a woman is scared but curious about hormone therapy, because obviously they've learned like all these like things that came out in the WHI study about, cardiovascular health and cancer, but they are interested in learning more. Like, what's the first conversation they should have with their doctor?
Yeah. So, I mean, you want to ask your doctor, what are the options available to me whenever I undergo menopause?
Okay.
What are the options available to me? There's also the Menopause Society, which is a very trusted source for menopause material information. They're very up to date. They do a lot of the leading research having to do with menopause and hormone replacement therapy, et cetera, et cetera. So the Menopause Society, that's what it's called, has a lot of information for both patients and providers.
Okay, awesome. And now I know you touched a little bit on cardiovascular health and women. Something that was really shocking to me was that, women die more of heart disease than breast cancer, but breast cancer has done a really great job at marketing itself and like creating so much awareness about this. Why are women dying off of heart disease more than, we know? Like what's happening? I mean, I know
Yeah,
it's a loaded question, but
it's a loaded question and I can give you a loaded answer. So how much time do you have? So, I'll start with historically, we tend to overlook women's symptoms. It's the truth. I mean, historically, we tend to overlook the symptoms that women present with when it comes to heart disease. The symptoms are not as strong as it is in men. They tend to be a bit more subtle. Because you hear in the news, oh, this happened to this man, 60 something years old, out of nowhere. They had crushing chest pain, brought to the emergency room, found to have a massive heart attack and passed away. So you hear that story a lot, right? But then for women, we don't usually present the same way. The symptoms are a bit more inconspicuous and therefore not taken as seriously. And this leads to undertreatment, delayed diagnoses, therefore, which is why we die of heart disease. So what are symptoms in women that we can look out for? So jaw pain. Jaw pain is one.
I didn't even know that.
Shortness of breath, extreme fatigue. That actually happened to a family member of mine, female, had extreme fatigue. Someone who's very active in their 60s, had a lot of fatigue, went to go get a CT coronary calcium score, which is basically a fancy picture of your heart, basically, to see if you have plaque in your arteries, and was found to have almost complete obstruction of one of the main heart arteries. So fatigue is a big one. Like, doesn't matter how much I sleep, I'm just so tired. She told me she would go to the gym, and she always went to the gym, and she was tired after 10 minutes at the gym, which is unlike her. So fatigue is a big one also. So that's why it's so important to go to your checkups for that reason, because you want to make sure that you have a doctor at hand who's on top of everything. And so basically overlooked symptoms. Also, I just think bad propaganda. We just haven't invested the money. Like, I do think there is, like, for example, the ACC, American College of Cardiology. I think they've done a better job, if I have to say, of, Heart Month, Women's Health Heart Month. And, I do think they've done a better job, but I still don't think we do enough. I still don't think
agree.
we do enough.
I agree. I mean, I just feel like breast cancer is like a case study of how they did it right. They like have a color, they have like a month that everybody across the globe is aware of. Like, and I think that if, heart disease is such a big issue, like that's something that within women, especially, is something that, you know, I don't know who would be responsible for putting this together, but we should create more awareness around it. Now, when it comes to menopause, how does menopause quietly increase heart disease risk?
Yeah. Yeah. So menopause increases heart disease risk primarily through the loss of protective estrogen. So, like I said before, estrogen is protective in the right amount at the right time. So, when you have a decline in the estrogen, then you have a lot of LDL, which is the bad cholesterol roaming around in your blood. You have increase in blood pressure. You have accumulation of the dangerous fat, which is the visceral fat, because estrogen is in charge of keeping that visceral fat in check. And so when you have the loss in estrogen, that's why menopause can definitely increase the risk. So it's a big, the transition to menopause is a big inflection point for heart disease risk in women.
So, I mean, this is an assumption and correct me. So then hormone therapy can help reduce the risk of heart disease within women during perimenopause
So
and
yeah, it can. It can. There's more studies being done on it, but it can add in small amounts and within the window, like early window of menopause. So I'd say I believe within the first couple years of entering menopause, that's when it's the most beneficial for heart disease.
like perimenopause era, like or
Well,
after.
perimenopause, you can technically still be on birth control.
Okay.
Yeah, you can technically still use birth control. I have a lot of patients who are in perimenopause that are on actual birth control because for them it's more useful, But I'd say within the first couple years of menopause,
Okay. And what, like, as a preventative form, like, what can women do before menopause to protect their heart health in the long term?
sleep, exercise, and a heart healthy diet. It's not as magical as we want to make it sound, but heart health is like general health. So being able to sleep the right so people who don't get enough sleep, whether it be because they're shift workers, whether it be because they have obstructive sleep apnea or whatever it may be, are higher risk of heart disease, obesity, diabetes, etc. So those who do not exercise, higher risk of heart disease, obesity, diabetes, etc. So it all goes back to nutrition, exercise, sleep, and going to the doctor for your checkups.
So you're telling me there's like no magic pill or detoxifier that
Well, there are statins. There are statins, and I do think statins are appropriate.
what are statins, if you can explain?
Of course. So statins are anti-cholesterol pills,
Okay.
to put it in simple, plain, language. What they do is they metabolize the cholesterol in your bloodstream, and they help that the cholesterol in your bloodstream is metabolized more readily, and therefore your levels come down. They are great drugs. They have a bad reputation because they can cause muscle aches, joint pain, etc. For the most part, most patients tolerate it. I have to say, most patients that I prescribe it, for the most part, tolerate it well. It's also important to prescribe small doses and work your way up, not to
Mm.
hit them with a really high dose right from the beginning. Um,
And for men and women, right? Like it doesn't matter.
Men and women. Yep. Yep. And, statins save lives. They really do. They save lives. But for primary prevention, which is like even before there's a cholesterol problem,
Mhm.
you want to make sure you sleep, eat, train right.
Okay. And now I want to talk a little bit about supplements. And like, I mean, I know right now where like there's a lot of influencers giving out like promo codes and, showing like, oh, this is what works for me. This is my supplement stack.
Did you see my reel yesterday on supplements?
I
I put it,
didn't. No, I haven't seen the one on supplements, but I will check it out. And so, like, what's real and what's marketing? Like, there's so much information out there. Like, is that like hope in a bottle? Like, is it like something that I think,
most of the
there's so
time,
much
yes.
information, but I love your input from like a medical and doctor's perspective.
Most of the time, it's hope and bottle. Most of the time. You don't really need that many supplements. You need supplements in certain instances. And usually in the United States, you don't really need supplements because the foods that we have usually have the vitamins and minerals and things that we need. Now, in different countries, that's a different story. But we're talking about the United States. For the most part, supplements are hope in a bottle. They're very specific. Probably the top 3 instances that I can think of needing supplements is vitamin D deficiency, and that's because it's hard to get the amount of vitamin D you need just from food and the sun, because you also don't want to expose yourself to that much sun because then you have the risk of skin cancer. So vitamin D is probably the most common reason for requiring a supplement. The next common reason is prenatals, because we saw that women who did not take prenatals, the babies had neural tube defects, had issues with that. So prenatal vitamins are essential. And then another instance where I can think of where supplements are useful is prescription fish oil. So not the fish oil you buy over the counter, but fish oil that's prescribed by your doctor. It can be used in instances of heart disease and high cholesterol and triglycerides that we can prescribe when needed.
Yeah, personal story with that fish oil prescribed, the one that's prescribed. My husband, he got it prescribed a few years ago and the insurance wouldn't cover it.
Yeah.
The insurance like, no, but you could take this. And it was like, well, that's not what my doctor's recommending. Like, we had to go out of our way to like find like, a pharmaceutical in Canada or like, like it's just like, it's so crazy that something as simple as like fish oil that is so preventative, like that some insurance companies won't consider like coverage for it. So it was very frustrating at the time. And yeah.
It is very frustrating. I agree.
So something that I find really interesting is that supplements really get like a free pass versus medicine, right? And like people are very easy to like recommend supplements, like, oh, take this and this and this. And like, but when it comes to medicine and you tell them, oh, you should take this or like talk to your doctor, they're like, oh, no, 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 I don't want to use that. Like, I heard so many bad things, but supplements don't get that bad rap. Like, why is that?
Because it's a multi-billion-dollar industry. That's essentially why. It's a multi-billion-dollar industry. It's a huge part of the health and wellness economy. It's literally a free for all, just like you said. So
Yeah.
that's why. It's sad, but it's true. That's why education is empowerment. Like education, be able to educate yourself on what, is appropriate, what isn't, is empowerment. You can do that with your doctor. You can do that by doing your own research, going to trusted sources, following trusted individuals on social media because authenticity shines through a screen. You can kind
Mm-hmm.
of, you can kind of tell who, what influencers is putting out like hoax. There's a lot of wellness influencers that put out BS, right? But there's also a good amount of really good wellness influencers and health influencers that really put a lot of good information out there, palatable information, really want to get the general public's attention. So you kind of have to have an eye for these things and really kind of, scout and do your research online from trusted sources, talk to your doctor. Like, hey, I know we only have a 15-minute visit, but what do you recommend? Like, what videos do you recommend I watch? What podcast or what source can I go to about this
Yeah.
and that?
Who's a reliable source? Yeah.
It's very important to just like maintain that curiosity and that inquisitiveness, especially when it comes to health.
Yeah. And can supplements interfere like lab results or hormone therapy or like, is
Yes, they
okay.
can. So supplements a lot of them are metabolized by the liver, and they can alter liver function, which is why we want to be careful. I'm forgetting this. What was that famous Herbalife? Is that the one? I think.
Yeah. Yeah, yeah.
Yeah,
Or
Herbalife.
that
It
it's
was.
like
I know it
a
was big in Miami. It was big here too.
yeah. It's like a pyramid thing where like you get people under you to sell and yeah.
I saw someone who was in liver failure due to taking Herbalife supplements and multiple supplements actually, and multiple patients taking like supplements. So a lot of times the supplement industry makes you think, well, you need a supplement for this, for this, for this. So then when maybe if you take one, it's not the end of the world. But when you end up falling for the propaganda of taking all of them at the same time, that's when usually the problems happen.
Yeah. So I mean, I guess if you had to pick one supplement, it would be a multivitamin. I mean, what's
So
something that
usually for the most part, a multivitamin is pretty benign.
yeah. Okay.
Probably like a woman's a day, like women's one a day, a men's one a
Yeah.
day.
And it doesn't have to be the expensive type. It doesn't like, I mean,
No, they
yeah,
sell some decent ones that are decent pricing.
like
So
over the counter.
yeah, you don't have to get like the fancy ritual one, or I forget the ones that Instagram sells that are like clear gelatin capsule and all that.
Yeah, yeah.
You don't have to. You can get a good old Centrum.
At Costco.
Yeah, exactly, exactly. But I think a multivitamin. Sometimes you need the extra vitamin D, then that could be a prescription from your doctor, or that could be also over the counter, depending. But for the most part, I think a multivitamin is suffice.
Okay. And as we wrap this up, like what's one piece of advice you give people as like they go on their health journey or, more specifically women going through perimenopause and menopause, like what one piece of advice do you give them as they try to figure out this new era that they're stepping into within their hormonal life, really? Because hormones like dictate so much of our lives that we didn't even realize before. So
Hmm.
what's one thing
Yeah.
that you would recommend we do?
Yeah. Advocate for yourself. You have to advocate for yourself. I mean, we're here to listen. A lot of us are here to listen. Yes, I've heard a lot of stories where they feel like the doctor's not listening. And again, all goes back to being a systemic problem. But if that doctor, if for whatever reason that doctor didn't sit well with you, we don't take it personal. You can find another doctor, another provider that aligns more with what you're looking for in a doctor. There are a lot of doctors that take insurance pretty, that are very good still, so advocating for yourself is probably the number one. And just be mindful about what symptoms, if something doesn't feel right, then it's time to bring it up to someone who can help.
Yeah, I read something somewhere where like if you start feeling symptoms, like write them down as you're feeling them.
Yeah.
And you
Like a
can
symptom
put like
diary.
in your notes app, and like put a date and what you felt. And then when you go to the doctor, like because sometimes appointments are not available that week or like in 2 weeks and they're available like
Hmm.
3 months from now, you have like a journal of what you've been feeling and it'll be easier for them to be able to diagnose what your
Yeah.
symptoms mean. So
100%. Yeah. Like a symptom diary. Yeah.
mhm,
It's always useful to have that. Always.
yeah.
Always for the
Well,
doctor and for the patient.
awesome. Well,
Yeah.
thank you so much. This was super helpful. I'm sure our community is going to love all the information and make sure to follow Dr. Marcelle Pignanelli
And let's
and
talk hormones. Let's underscore talk hormones.
Let's Talk Hormones at Let's Talk Hormones. We'll put it on the caption. And thank you again. It was awesome meeting you,
Thank
talking to
you.
you.
Thank
And
you. And I
how's
hope
the
we keep
weather
in
in New York
touch.
right now? Are you guys freezing?
We're not that bad now. No, the temperature we're in the 40s now, so it feels like summer, to be honest. It was so
I
bad.
won't
It
brag
was
about what we are in Miami right now.
I know, I know. Oh gosh, I know. I'm
So,
jealous.
well, thank you, Marcelle. Have a good one.
Yes, no, of course, anytime, and we'll keep in touch. Take care.